Hello, welcome to JAMA Health Forum Conversations. I'm Dr. Sandro Galea. I serve as Dean of the School of Public Health at Washington University in St. Louis and the Editor-in-Chief of JAMA Health Forum, peer-reviewed open access online journal focused on health policy, healthcare systems, and population health. JAMA Health Forum is one of 12 specialty journals in the JAMA network. In 2022, the world was introduced to ChatGPT, a generative artificial intelligence chatbot developed by OpenAI. Since then, AI has become an increasingly ubiquitous presence in our world, including in the area of health. From assisting with healthcare administration to shaping new treatments, AI has much potential to do good. But as we have seen with the rise of social media, the early promise of new tech can lead to pitfalls, both foreseen and unforeseen, making AI regulation of central concern in this moment. As the technology evolves, so should the laws and approaches we apply to ensuring its proper use. Today's guest is an expert in understanding how we can do so. Dr. Michelle Mello is a professor of law and of health policy at Stanford, holding a joint appointment at the law school and the School of Medicine. She studies how law and regulation influence healthcare delivery and population health outcomes. A member of National Academy of Medicine, she has written extensively on medical liability and patient safety, ethical and legal issues arising in biomedical research, and artificial intelligence, among other topics. She is co-director of the Healthcare Ethical Assessment Lab for Artificial Intelligence at Stanford University, which conducts ethical assessments of AI tools proposed for deployment at Stanford healthcare facilities. I am delighted to be speaking with Professor Mello today. Michelle, welcome.
Thanks so much for having me.
How did you become interested in the use of AI in health settings? And what are some examples of how AI is currently being used in these settings?
Stanford sits in the heart of Silicon Valley. You literally can't drive a mile down our freeway without seeing a billboard for somebody's new AI product. And the doors between Stanford University and Valley companies are always open. So it was very natural that Stanford chose to become a leader, both in the innovation of development of AI and, importantly, in its governance and responsible use. When the health system got very serious about the governance piece a couple of years ago, I was approached by a clinical colleague to join a team of ethicists who had been asked to do these evaluations for the hospital to make sure that we weren't missing important issues that could arise and potentially harm patients, our providers, or the hospital. And since I've gotten involved in that work, I've become aware of just how extensive the array of AI tools is that are operating in healthcare settings today, including here at Stanford. And I think many of us tend to bucket them into sort of a 3x2 table. So the two columns of that table would be predictive AI tools, the sort of first generation of tools that aim to classify patients or other observational units into different buckets. And the second column would be generative AI, which of course has only been around now for about a year and a half, but has really taken the healthcare world by storm. And then the rows, I would say, are clinical decision support tools. Those are the tools that get the most attention because they aim to guide diagnostic and treatment decisions. Administrative operational tools that help hospitals and healthcare organizations run better, deal with insurance companies better, and help their clinical staff take care of the more mundane side of medical practice, like note-taking. And then finally, there are direct-to-consumer apps of various kinds, which even healthcare systems get involved in thinking about because sometimes our providers recommend them to our patients, and very often our providers have to deal with the consequences of patients using them, coming to the clinic with all kinds of new ideas about their health. So again, just a huge range of tools. Probably the most prevalent use of healthcare AI tools today in the United States are clinical summarization tools, which use generative AI, large language models, to take notes on clinic visits, summarize what happened in the last 12 hours of a hospital patient's care, things of that nature. And that's an example of an administrative tool, but it's one that is beginning to bridge into clinical decision support because, of course, the clinical notes that physicians and nurses take very much can affect the care that patients receive.
Let's talk a little bit about the upsides and downsides. Talk us through your view of the upsides and downsides of AI in the health space, the potential to do good and to cause harm, and that can lead naturally, I think, into why it may be necessary to regulate its use.
I think the upside is huge. Before I turned to studying AI, I spent 2 decades studying patient safety, medical errors, and medical liability in the US. And it's become clear that despite the progress we've made in the patient safety movement, there's still so many areas where mistakes get made in medicine, or patients just are not connected with optimal care because there are all kinds of biases and barriers in the system. So there's so much missed opportunity to do better and to do it more efficiently at the same time. And yet, at the same time, clinicians seem to feel more and more squeezed every year, despite this continued underperformance. So I think there is really big potential for AI to begin to chip away at some of those really tenacious problems in human healthcare, like clinical documentation. That's a huge one. For every hour that physicians spend face to face with patients, they spend 2 hours on EHR documentation. And that's a major contributor to burnout and an area where AI seems extremely promising. And on the diagnostic side, missed and delayed diagnoses, such a tricky problem to solve. We made a lot of progress, but there's still a lot of saves and diagnosis that come from patients' fortunate happenstance to have a physician who has a specific kind of experience. It just happens to notice something or think of something that others would not have. So there's a lot of operating from the gut to the extent that we can use data to try to bring those kinds of saves to a bigger range of patients. That seems really huge. Of course, all this comes with risk. There will be risk that there are errors in the AI output that busy clinicians just don't catch and fix and that reach patients. There are also risks that adoption of AI will continue to be uneven. And so while it has the promise to improve care for patients who don't have access to the best specialists now, it also has the potential to widen disparities in care. There's a risk that patients will be even more tempted to let cost concerns keep them from seeking care when they should be seeking it because there's some AI tool online that they can consult instead. And then on the labor side, there's a risk that the saved time from using operational tools in healthcare might be repurposed in ways that work against our goal of preventing burnout. It's just very tempting for organizations to try to use that savings to drive additional revenue collection and productivity. So lots of different kinds of risks. And what concerns me is that we lack a structure right now for assessing and trying to mitigate that risk. As we could talk about, there just is very little formal regulation that would be driving organizations to do that. There's, I think, a lot of pressure among healthcare organizations to stay or get on the leading edge of innovation in the AI space. They mostly talk to vendors who lay on the hype pretty thick and are less interested in talking about some of the downside risk associated with their products. And a lot of the deployments of AI tools are taking place in the context of very time-pressured, capacity-constrained systems of care that leave little space for users to tap the brakes, assess what they're seeing in AI output, and really evaluate it. So it's not a good mix of conditions for managing risk.
So you wrote this paper with Glenn Cohen and JAMA. It was called "In the U.S., Health and Healthcare Artificial Intelligence Tools Grow in a Liminal Regulatory Space." First of all, congratulations for the word liminal in the title. It's sort of, I don't think I've seen that before in JAMA. You talk in this paper about how the Biden administration made some efforts to regulate AI, which are currently being rolled back by the Trump administration. So can you guide us through pragmatically a sense of where the regulatory landscape for AI is and how it has changed and is changing?
I think it can be summarized by saying there was a nascent attempt in 2023 to 2024 to try to start erecting some guardrails around AI safety risks. And then there has been a reversal of that and a refocusing of the federal government's attention on supporting innovation. So to unpack that a little bit, former President Biden issued a number of executive orders that are germane to AI, but most importantly for our purposes, in October of 2023, he issued an executive order focused on high-risk uses of AI, including use in healthcare decisions. And among many other things, that executive order directed federal agencies to use existing laws to try to police AI uses that might be unfair or deceptive business practices, that might be privacy violations, or that might be violations of anti-discrimination law. He committed federal agencies to doing a range of things to try to stimulate AI innovation, which would have meant more federal research dollars for universities, easing pathways for getting foreign talent into the United States for innovation, and so on. He also called for setting standards for safe and trustworthy AI and creating policies to ensure that those standards were met. And he initiated a program that would be a public-private partnership to stand up what he called assurance labs that would conduct evaluations of AI tools in real-world settings, in part out of recognition that not every hospital is a Stanford or a Mayo Clinic. There will be places that need help with AI monitoring. And that, too, would have meant a great deal of federal money going into the cause of AI oversight. President Trump rescinded that executive order right out of the gate in January of 2025, and he replaced it with one that very much emphasizes innovation in AI development and specifically the goal of making sure that America is number one in the world in AI development and is not outdone by the Chinese or other competitors. So there were little tricklings of the meaning of that EO coming out of NIST, which is a standard setting organization of the federal government, that issued instructions to take the words AI safety or responsible AI out of the list of skills that it expects scientists to have when partnering with this new thing that had been created called the U.S. AI Safety Institute. So now we have people contributing to AI safety efforts who don't need to have any expertise in AI safety. The administration said instead the priority is keeping AI systems, as it said, free from ideological bias or engineered social agendas, and again, on improving American competitiveness. The final layer in the last few months has been that with the DOGE efforts, we've seen mass firings in federal agencies like the FDA that had been working on efforts to oversee AI, and that's called into question their continuing ability to do that effectively.
That's a nice summary of the evolution. Thank you. Can you just guide us through, for those of us who don't know this world, the federal agencies that actually have the latitude in the AI regulation and what powers they have to effectively regulate AI in health?
Yeah, so AI is obviously a technology that crosses sectors, and we don't have an institute for AI that has a cabinet level place in the government. So the responsibility for it is fragmented. In the healthcare space, the FDA has been by far the most important regulator because it possesses the ability to regulate quote unquote medical devices, which it has chosen to define in some cases as including certain kinds of software. And Congress has, to a large extent, gone along with that interpretation. So it has the power to issue pre-market clearance for certain kinds of AI tools. The Centers for Medicare and Medicaid Services should, in theory, have some ability to create rules that govern what the entities that it has jurisdiction over do with AI, which is to say, if you would like to do business as a healthcare provider or a health insurer with Medicare or Medicaid, you might be required to do certain things to demonstrate that you're using AI responsibly. It hasn't done that, but it certainly could within the conditions of participation. Then there's the Office of the National Coordinator of Information Technology. ONC is administering a relatively new rule called HTI 1, which implements provisions of a federal law called the 21st Century Cures Act. And its focus is on the IT itself, on the AI algorithms, and on the developers. And essentially, it says if you would like to participate in a voluntary certification program that we're running, you have to do X, Y, and Z to show that you are being adequately transparent about how your algorithm works and you've taken steps to reduce bias and so forth. But again, that's a voluntary program. And then I guess I throw one other agency in there, which is the Office of Civil Rights within DHHS. That office is tasked with preventing discrimination in healthcare. The Biden administration had issued a rule prompting it to get involved in policing whether algorithms might be biased or used in ways that give rise to discrimination. And it issued a rule to that effect. It's not at all clear that the present administration is interested in enforcing that rule, but in theory, OCR has some power here as well.
What do you think are the key regulatory gaps right now in the use of AI in health?
I think relative to other technologies, other medical devices, and certainly drugs, there is much less pre-market review that goes on, meaning that I can start a company and develop an AI tool and go out and sell it, and the government has very little to say about how my tool works or whether it works or whether it's safe. As I said, the FDA does have authority to regulate certain kinds of software as a medical device, but it's limited. Without going into detail, the upshot is that overwhelmingly, the kinds of AI tools that get submitted for pre-market clearance have been radiological devices, mammography interpretation assist, or something of that nature. So most kinds of tools that are being used in healthcare don't go through FDA. And that's, again, because it's not clear under their statute that they have the ability to regulate those kinds of devices. And maybe a few years ago, some bold thinkers at FDA might be willing to go out on a limb and say, we're going to interpret our authority as being expansive. We think it's consistent with what Congress would say if they were to act now. But the Supreme Court has, in the last couple of years, made it much more hazardous for federal agencies to do that. Under a series of rulings, they have really curtailed the amount of discretion that federal agency heads have to say, this is what I think Congress intended to let my agency regulate. So that kind of boldness is not around at the moment for very good reason. And instead, FDA has been doing things through guidance documents rather than rulemaking, meaning that it's telling industry how it sees the world, but these are not legally binding documents. So there are gaps around what FDA can do. ONC, as I said, has a voluntary certification program. That's obviously a gap. And then CMS has done some things around what Medicare Advantage plans can use AI algorithms for in making coverage decisions, but beyond that has not really ventured into this space. But it's really the only agency that could effectively govern users, adopting organizations rather than developers. And as I said, I don't think that there's going to be OCR enforcement of this anti-discrimination rule. So at the federal level, there's a lot of quiet around AI regulation at this time.
Moving beyond the federal level, let's talk about the state level. You've actually written a little bit about this, about the state level activity. Talk us through how active states have been and what role can states actually play in AI regulation?
They've been very active. In 2024, nearly every state considered bills relating to AI regulation, and 31 adopted some kind of legislation or resolution. Popular approaches include transparency requirements. Developers have to disclose X, Y, and Z about their products, and rules about the use of AI algorithms in prior authorization decisions by insurers. There are some states that have gone further and imposed really quite substantive requirements that organizations that develop or deploy AI models that influence important decisions like healthcare take steps to avoid bias and to do some things in the governance space. So all of this has been very interesting to watch it unfold. It's certainly not the best way to go about regulating a product that's sold nationally and an industry that crosses state lines. And it's run into a problem just in the last couple of months in the House Appropriations Bill, this big, beautiful bill, because that bill contains a provision imposing a 10-year moratorium on virtually all state regulation of AI.
Tie that in now to the courts. What's the role of the courts?
Well, the role of the courts is to plug some of these holes in the regulatory landscape. You know, typically when we historically have seen a new technology come onto the marketplace with very little formal regulation, and it either begins hurting people often or raises the specter that it will hurt people often, the courts will step in and create a remedy for those injuries with the intention of sending signals to the people selling and using these products that they need to behave more safely. So that's the historical role of tort in filling regulatory gaps. I think we will see more and more of that. We haven't seen a lot of it yet. But the courts will eventually have to resolve questions about what medical malpractice looks like when AI is involved, what product liability looks like for AI. Is AI a product or not? So I don't think they've had a huge role yet in our space. A lot of their attention has been occupied with questions about intellectual property and generative AI, but it will happen.
Let me go back to something you've written. I'll just read you a sentence from a paper you wrote with Glenn Cohen. The long game for AI regulation must involve strengthening the authority of agencies within US DHHS to adopt standards with which developers and adopters of AI tools must comply. So I'm actually wondering what you think about that sentence in the current context where regulatory actions have been subject to rollback through administrations, and how does it change our thinking about where the right action should be taken to try to create some durable regulation?
I certainly think that this presidential changeover has underscored how much regulations can flip from one president to the next. But I don't think we can give up on agencies as leaders in this area. It's just too technical to leave in the hands of legislatures to adopt detailed rules. I don't want to enshrine in some legislation detailed standards about what AI should look like or how it should be used, because it's changing so rapidly and legislation is so sticky, so hard to change. So it may be that we are going to have to wait a few years to get vigorous regulation, but I would honestly rather have that than have big mistakes made in legislative approaches that are very hard to undo. And the bright side of regulations being easily rescinded is that they can also be rescinded if they just turn out to be wrong-headed. And I think there's a real risk of getting things wrong in the standards that we set at this very early stage.
Is there an opening for healthcare organizations to engage directly with the tech companies developing AI to make sure that the work is done in a way that actually supports effective functioning of health systems, to develop guardrails for AI that are not regulatory but technical, for example, controlling, monitoring, deployment of AI through the use of other AIs?
I think we absolutely need healthcare organizations to step up and institute their own governance schemes. Just because they don't have to doesn't mean that they shouldn't. If I was a lawyer for a healthcare organization, I would be extremely nervous about it using AI without some process of vetting and monitoring it. I don't think we want to let the vendors set the standards, though. The healthcare organizations need to lead here. And what they can and should do is be partnering with vendors to implement the standards that are important to them, meaning that the vendors are the ones that have the information about how their tools work, where they don't work so well, how users should be trained to look out for the ways that they don't work so well, and then to help them out with dashboards and other technical support for monitoring. And there's just not a lot of incentives for them to do that right now. But if healthcare organizations start making it clear that this is an important condition of their purchases in a competitive market, hopefully they should. I'm a little skeptical that automated monitoring is going to get us to where we need to be in terms of governance. I think there are some functions that AI can do to police other AI, but I'm learning that a lot of the trouble spots can come not from how the tool itself works, but from how physicians and nurses use it and the environments that healthcare organizations expect them to use it within. And that takes a human touch to regulate.
We're talking about AI. I think anybody who's listening to this will, at this point, be thinking and using AI. And it's remarkable to remember that actually we were not talking about AI at all 2 years ago. So it's really becoming ubiquitous very quickly. And it's hard to see what the limiting principle is going to be with respect to its evolution. So I guess my question is, might we get to a moment where AI is not just a digital tool among other digital tools, but something that is larger than we can keep up with through regulation? I guess I'm curious how AI governance can keep pace with something that's evolving so quickly, and hearing what you just said a second ago about the very reasonable caution about not putting in place regulation that's overly restrictive and that maybe perhaps we learn is wrong soon after.
I think it's already a force that can't be fully managed through regulation because it is evolving so quickly, both technically and in the range of uses. To think that a legislature or a federal agency can stay on top of all that change is farcical. But what we can do is create stronger incentives, maybe requirements for users and developers of these technologies to be on top of governance themselves. And they will always be at the leading edge of understanding what's going on in the marketplace. So rather than sitting around waiting for the next administration to come in and solve all our problems with better rulemaking, I think we need to be moving forward with private governance now. I think there's great need for healthcare organizations as they learn how to do this to share information with one another. And this approach, again, as we've talked about, has the advantage of being flexible as we learn what works and what doesn't in governance and regulation, what is important to do, what's less important. We can be nimble in evolving that approach.
Last question. This builds on something you alluded to earlier. You alluded to the fact that this is ultimately a commercial product for which there's competition. So what are your views on balancing sensible regulation of AI with the recognition that actually this is a pretty high-stakes global competition for AI innovation that has enormous implications, actually, for economic functioning in the country?
Right now, there's so much focus across all sectors in our competitiveness with China, other countries that are going faster, cheaper than we are. And as a lawyer, of course, I always think that there's some role for regulation in making markets work better, including on the global scale. But I also think we have to acknowledge that if we are not willing to balance being first and fastest with other values, we're going to move off of the goalpost that we want to be centered on. And by that, I mean, in other sectors, we do not say that our first and only goal is to be fastest and cheapest. We also value preservation of the environment, protection of workers, protection of consumers against deceptive, dangerous, or unfair practices. And that is always going to put us behind other countries in terms of being able to develop and sell products fast and cheap. And I'm okay with that, as long as the regulations are evidence-based and sensible. I think that's the sweet spot for American innovation in AI.
Well, it seems to me the balance between being fastest and, let's say, most commercially viable with other values is perhaps a fundamental tension of our time, not just about AI, but about all sorts of other things.
Absolutely.
I'm Sandro Galea. I've been talking with Professor Michelle Mello about the promise and perils of AI, its implications for health, and how regulation can help support the safe, ethical uses of this new technology. Thank you, Michelle, for joining us.
Thank you.
This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, jamahealthforum.com, or search for JAMA Network wherever you get your podcasts. Everybody, thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.